Smoking is incredibly harmful. Not only does it affect the lungs, but it also has a significant impact on other parts of the body. We all know that it damages our lungs, causing diseases such as lung cancer and chronic obstructive pulmonary disease. But did you know that smoking is a major risk factor for bladder cancer? Toxins from cigarette smoke seep into the blood and eventually reach the bladder. This serious disease affects thousands of people every year. Bladder cancer can be aggressive and requires intensive treatment. This video explores the connection between smoking and bladder cancer. We'll look at how chemicals in tobacco damage bladder cells. We will discuss the dangers and provide essential information to help you make informed decisions about your health. Knowing the risks is the first step to preventing this disease. It's time to understand the risks associated with smoking. Knowledge is power. By understanding how smoking affects your bladder, you can take steps to protect yourself and save your life. And taking control of your health starts with understanding the impact of your choices. Quitting smoking can significantly reduce your risk of developing bladder cancer. Let's dig deeper and learn more about this preventable disease. Together, we can take steps to reduce our risks and improve our health. The numbers don't lie. Smoking significantly increases your risk of developing bladder cancer. Studies show that smokers are at least 3 times more likely to develop bladder cancer than non-smokers. Think about that for a moment. That's a staggering statistic. In fact, smoking is responsible for about half of all bladder cancer cases. A 2019 study found that smoking is responsible for about 65% of bladder cancer cases in men and 20 to 30% in women. In 2022, approximately 81,000 people in the United States were diagnosed with bladder cancer, making it the 4th most common cancer in men and the 11th most common cancer in women. Smoking is the most important modifiable factor associated with bladder cancer risk, accounting for nearly half, 47% of all cases in the United States. It's something to think seriously about. The good news? Quitting smoking can dramatically reduce your risk. Even after quitting smoking, the risk of bladder cancer remains elevated for several years. However, this risk gradually decreases over time, dropping by 25% during the first decade after quitting smoking. Every time you take a puff on a cigarette, you release a cocktail of harmful chemicals into your body. These toxins, including nicotine, tar, arsenic, and formaldehyde, don't just go away. They travel through your bloodstream and are filtered by your kidneys. Guess where they end up? In your bladder. These harmful substances irritate the lining of your bladder. Prolonged exposure increases the risk of cancer cells growing. Over time, this chronic irritation can cause cellular changes that can lead to cancer. The longer you smoke, the greater the damage and the greater your risk. What is bladder cancer? Bladder cancer begins when cells in the bladder start to grow out of control. Over time, these cells can form a tumor and eventually spread to other parts of the body. But what causes these cells to mutate and grow out of control in the first place? The bladder is a hollow organ located in the lower abdomen, responsible for storing urine. It plays a crucial role in the body's waste removal system. Understanding the anatomy of the bladder helps us understand how toxins, including those from tobacco, can directly affect its tissues. Early warning signs. Recognizing the symptoms. Bladder cancer often has noticeable symptoms. One of the most common signs is blood in the urine, also known as hematuria. This may manifest as visible blood or a pink tint in the urine. Other symptoms include pain or burning when urinating, frequent urination, and a persistent need to urinate, even when the bladder is empty. If you experience any of these symptoms, especially if you are a smoker, it is crucial to consult a doctor immediately. How is bladder cancer diagnosed? Diagnosing bladder cancer involves a combination of tests and procedures. Your doctor will likely start with a physical exam and after review of your medical history. He or she may order a urinalysis to check for blood or other abnormalities in your urine. A cystoscopy is a key diagnostic tool. During this procedure, a thin, flexible tube with a camera is inserted into the bladder through the urethra. This allows the doctor to visualize the lining of the bladder and look for tumors or abnormalities, as well as assess its size and location, as well as its relationship and extension to the ureteral metastases, the bladder neck, and the urethra. Early detection of bladder cancer significantly improves treatment outcomes. Regular screening tests, such as cystoscopy and urinary cytology, can help detect abnormalities early. Smokers, in particular, should be vigilant and consider regular screening as part of their health routine. Ruling out other entities. Differential diagnosis. It is important to note that bladder cancer is not the only condition that can cause these symptoms. Urinary tract infections, bladder stones, and other urological conditions may present similar symptoms. That is why a complete medical evaluation is crucial to rule out other possibilities. Your doctor will consider your symptoms, medical history, and the results of diagnostic tests to determine the underlying cause of your symptoms. An accurate diagnosis is essential to guide appropriate treatment. Treatment options: a multifaceted approach. The treatment approach for bladder cancer depends on several factors, including the stage and grade of the tumor, the patient's overall health, and his or her preferences. Each case is unique and requires careful evaluation by a multidisciplinary team of healthcare professionals. The patient's overall health and preferences play a crucial role in determining the most appropriate treatment plan. It is important that patients feel comfortable and well informed about their options. Treatment options may include surgery, chemotherapy, radiation therapy, or a combination of these modalities. Surgery is often the primary treatment for bladder cancer, especially in early stages. In some cases, a combination of treatments may be recommended to increase effectiveness and reduce the risk of recurrence. Chemotherapy and radiation therapy may be used to kill cancer cells or shrink tumors before or after surgery. Surgery is often the main treatment for bladder cancer. The extent of surgery varies depending on the size and location of the tumor. In some cases, the entire bladder may need to be removed, while in others, only part of the bladder is removed. A transurethral resection of a bladder tumor, TUR, is often used to find out if a person has bladder cancer, and if so, whether the cancer has spread, invaded, into the muscle layer of the bladder wall. TUR is also the most common treatment for early stage or superficial, invasive, not involving the muscle layer, bladder cancers. This is usually the first treatment, as most patients have superficial cancer when they are first diagnosed. A thin, rigid type of cystoscope, called a resectoscope, is placed into the bladder through the urethra. The resectoscope has a wire loop at the end that is used to remove any tumors or abnormal tissue. The removed tissue is sent to a laboratory for further analysis. When there is invasive bladder cancer, part or all of the bladder may need to be removed. This operation is called a cystectomy. Most of the time, chemotherapy is given before the cystectomy is done. Partial cystectomy: if the cancer has invaded the muscle layer of the bladder wall but is not very large and is only in one place, it can sometimes be removed along with part of the bladder wall without removing the entire bladder. Radical cystectomy: if the cancer is larger or is in more than one part of the bladder, a radical cystectomy will be needed. This operation removes the entire bladder and nearby lymph nodes. In men, the prostate and seminal vesicles are also removed. In women, the ovaries, fallopian tubes, uterus, cervix, and a small part of the vagina are also removed. Reconstructive surgery after radical cystectomy: if your entire bladder is removed, you will need another way to store urine and pass it out of your body. Several types of reconstructive surgeries can be done. Incontinent diversion: A direct connection can be made between the ureter and the skin of the abdomen called a cutaneous ureterostomy, or a section of small intestine can be used for the same purpose called a urinary conduit. In both cases, urine flows freely to the outside and is collected by a collection bag fitted to the skin. Another way to drain urine is through a continent diversion. A pouch is created from a portion of the intestine that is attached to the ureters. One end of the pouch of intestine tissue is connected to an opening, stoma, in the skin on the front of your belly. Neobladder. This method directs urine back into the urethra, so you pass urine in the same way. To do this, the surgeon creates a new bladder, neobladder, from a piece of bowel. As with incontinent and continent diversion, the ureters are connected to the neobladder. The difference is that the neobladder is also sewn to the urethra. This allows you to urinate normally on a set schedule. Intravesical chemotherapy. For this treatment, the chemotherapy drug is given directly into the bladder. This type of chemo is used for bladder cancer that is only in the lining of the bladder. Systemic chemotherapy. When chemotherapy drugs are given in tablet form or by injection into a vein or muscle, the drugs enter the bloodstream and travel throughout the body. This is called systemic chemotherapy. Systemic chemotherapy can affect cancer cells anywhere in the body. Radiation therapy uses high-energy rays to destroy bladder cancer cells. Treatment will depend on the type of bladder cancer, the location of the tumor, and whether or not the cancer has spread. You may receive radiation therapy before, during, or after surgery. Radiation can shrink tumors or kill bladder cancer cells that remain after other treatments. Take control of your health. Quit smoking today. Smoking not only affects your lungs, but it also has a devastating impact on your overall health. Every cigarette you smoke contains over 7,000 chemicals, many of which are toxic and can cause cancer. The link between smoking and bladder cancer is undeniable. Studies have shown that smokers have a significantly higher risk of developing bladder cancer compared to non-smokers. Chemicals in tobacco smoke seep into the blood and are excreted in urine, damaging the lining of the bladder. But there is a powerful message of hope. Quitting smoking can significantly reduce your risk of developing this disease. In fact, the benefits of quitting smoking begin almost immediately. In just 20 minutes, your heart rate and blood pressure decrease. Within a few weeks, your circulation improves and your lung function increases. It's never too late to quit smoking. No matter how long you've smoked, quitting can improve your health and prolong your life. People who quit smoking before age 50 halve their risk of dying in the next 15 years compared to those who continue to smoke. Quitting smoking is one of the most important steps you can take to protect your health. In addition to reducing your risk of cancer, it also lowers your risk of heart disease, stroke, and respiratory diseases. It also improves your quality of life, allowing you to enjoy physical and social activities without the constraints of smoking. Talk to your doctor about resources available to help you quit smoking. There are medications, counseling programs, and nicotine replacement therapies that can increase your chances of success. You don't have to do it alone. Help is available, and support groups designed to guide you on your path to a smoke-free life. Joining a support group can provide you with the motivation and encouragement you need to stay on track. Sharing your experiences and hearing those of others can be a powerful source of inspiration. Take control of your health today. Incorporate healthy habits like regular exercise, a balanced diet, and stress management techniques to help you stay smoke-free. Every day you are smoke-free is a step toward a healthier, happier life. Choose to quit smoking and choose life. By quitting smoking, you not only improve your health, but you also set a positive example for your loved ones. Together, we can create a healthier, smoke-free future. Do you like our content? We would be very happy with a like, subscribe, activate the bell, and share this video so more people can see it.